Yeah, those 4 kids are teenagers. Do not recommend. Well, you've cried and you've danced, and now I'm just going to bore you to tears with some health advice. How about that? I've got, what's the opposite of Vanna? Pat? You get, oh, come on. Pat, Vanna, Pat, get it? Okay, Pat. I know that's not your name. So I just want to talk just briefly about what is health. And you might think it's kind of a natural thing, like health is like not being sick, right? Well, yeah, sorta. Maybe a better way to call it is being well. You can be physically healthy and be unwell, right? And maybe even vice versa. But it is a state of all of our different kinds of well-being, physical and emotional and spiritual and even financial and psychological. So it's a multi-play effort to make us healthy. And none of those parts are independent from one another, right? When you're really worried about something, your body gets sick sometimes, or sometimes when your body is ill, it can really drag you down mentally. So it's an entire state. Just as you've already heard, and I promise I didn't set up any of this, and yes, my mother told me lipstick, and I just put some on. And I heard some of you may have also had a mother like I did. Make sure you got on good underwear, and it's clean and without holes, because, and I've told her, since I became a doctor, I'm like, Mom, we just cut that off. Nobody looks at that. Nobody cares. Well, I just wouldn't want somebody going to church and tell them. No, I promise. Nobody is going to tell, the doctor is not going to tell anybody in church whether your underwear had holes in it or not. But we may get a little laugh out of it. Anyway, just kidding. One thing that you need to remember, and you guys already know this, is we have a lot of responsibilities for taking care of others. And that, really doesn't stop outside of the walls of our house, right? But we have to know to take care of ourselves first. So, the next thing we're going to do is talk about lies. Let's talk about the lies. Okay? Let's just get real. People who work with me and know me, I just don't have time to be fake. Let's just be real. So let's talk about the myths that we believe. All right, Pat, myth number 1. I don't know if you've heard this, but like fill in the blank. When I say chronic disease, you can fill in the blank with diabetes, high blood pressure, heart disease, emphysema, COPD, whatever chronic disease you want to do. It's mostly genetic, and I'm pretty much destined to do that. Maybe I can feel better if I do something. There's really not much I can do about it. Okay, we're going to have a little audience participation before the next slide, because the next slide has the answers on it. How much do you think genetics plays in these chronic diseases? Shout out a number. 80% genetics, what else? 100% genetics, what else? 10% genetics? 40, or y'all are like my kids on the elevator, just go press all the buttons. Somebody's gonna be right. Okay, I hate to break it to you. Next slide. Thank you. It's 20% genetics. Oh. Yeah, okay, so, I should warn you, we've got 3 myths to cover, and they get progressively more uncomfortable, okay? So this one's really safe. 20% genetics. That means, like, the majority is not genetics. 60% of all of these diseases up here, if you can see, heart disease, diabetes, stroke, most cancers, COPD, some people call that emphysema, peripheral vascular disease, and joint problems. 60% are caused by the things that we do. People oftentimes ask me why I chose pediatrics. And sometimes I say it tongue-in-cheek, but sometimes I mean it. Like, because they don't do bad things to themselves generally, like adults do. And this adult is included too, okay? So just like Melissa and others said, when I'm talking to you, I'm talking to me too. And so, yes, I got a big handful of those gummy bears in the back. It's wonderful. But But those are modifiable behaviors. So those are things that you can do to change. The take-home message is just because you have a lot of people in your family or you think you're predetermined to have some type of illness or disease, doesn't mean you have to. Also, if you already have that disease, it doesn't mean you have to have it forever or have it as badly forever. So 60% of those are things that we do ourselves. So I could literally do the entire, what is my presentation, 2 hours tonight? I turn into a pumpkin at 8:45, so you don't have to worry about me talking that long. This is like almost my bedtime. These last 4 bullet points, I kid you not oversimplifying, this is like how to stay healthy. Now, some of you know, I'm from Gibson County. I grew up on a farm. I mean, it's just kind of like practical wisdom. All right, so let's talk about eating. It doesn't have to be complicated. You don't have to do, if you want to do calorie counting and carb counting, that's great, more power to you. It gets complicated pretty quickly. Let's talk about some simple rules. Now, I'm not here to endorse a book or promote a book, but one that this, under the eating section came from. It's pretty simple. It's called Food Rules. It's Michael Pollan, P-O-L-L-A-N. And it's this quick little read. I don't know if it's 40, 50 things in there. But these are some of the ones that I can remember. And one that I think is really important is eating at home. And for me, with 4 teenagers and a husband who, he's a cyclist, and so, he's like, I burned 4,000 calories today. Shut up. Somebody had to work today. He's like, I went to work, but I rode my bike at lunch and after work. That's great for you. Because he eats more than all the teenagers put together. Just quite frankly, we can't afford to eat out a lot. And so we cook at home a lot. But all joking aside, it's a much healthier place to eat. Besides the financial piece of it, it's a lot healthier place to eat because you know what restaurants do to get their food to taste really good? Put a lot of butter and salt in it. It's delicious. It's really bad for you. And so the other thing restaurants do, because I won't ask you to raise your hand, but I know it's happened to me. I haven't said the punchline yet. I haven't said it. Cut her off at the bar, please. No, I love it. I've forgotten what I was talking about. Anyway, we're talking about eating at home. It'll come back to me here in a minute.
Eating out.
Eating out. Oh yeah. You know what else they do? Besides a lot of butter and salt, they give you a really big portion.
Yes. Yeah.
And if you ever go to a restaurant who serves you a normal portion, what are you gonna say? They didn't give me any food. I am not paying $27 for this tiny little piece of steak. Because that might be a normal portion of food, and that crazy cyclist that lives in my house, he goes where apparently people in Europe like to ride bikes a lot and wear spandex, and so he wants to go to Europe and ride bikes and wear spandex, and so we went over there this summer and we were laughing because, we would go to a restaurant and they would sit that plate down in front of us, and it was normal portions. And let me tell you, even this country girl was like, well, dang, I wish I could get some food around here. So portion size is something that restaurants don't do very well. They want to give you value, that's why we go. But eating at home, you know what's in your food and you know how to control the portion size better. Another tip that is in the book that I like is if you think about your favorite grocery store. And this pretty much applies to any grocery store you've ever been to. If you will shop the periphery, that means like the outer rim, the outer edge, that's where the good stuff is. The milk, the dairy, the eggs, the cheese, the meat, the produce, the bakery, but most of the time, the stuff on the outside is where the healthy stuff is. So if you just try to think, when next time you're in the grocery store, let me see if I kind of always have these competitions kind of in my own head with myself. Can I get 2/3 of everything that I buy on the outside? Or can I get at least half? Another way, something similar to this is, think back, most of you remember your great-grandparents? Maybe, grandparents at least. If you took whatever you're eating, and just took it out of any kind of packaging and put it on a plate and handed it to your grandmother or great-grandmother with no context, would she recognize it? Could you give your great-grandmother a plate full of Fruity Pebbles and go, look at this. What is that? Those are unnatural colors and shapes and all kinds of things. Where does that grow? And so that's another way of knowing what to eat. It doesn't have to be complicated. Doing things, eating like your great-grandparents did or your grandparents did. Another way, and I heard a friend of mine who's a physician, he grew up in Chester County, I was making rounds with him one day, and he told his patients, if you couldn't eat it, grow it, catch it, or shoot it, you probably just shouldn't eat it. That's good practical wisdom. Another way to say this, Oprah talks about making your plate colorful. Everybody kind of already knows that one. But this 1 is better than 2 is better than 4. In this book that I referenced, that's how many legs your food has. So a vegetable has 1 leg, stalk. And then poultry has 2 legs, which is better than things with 4 legs, pork and beef. And so I'm trying to tell you, it's not hard to eat well. It's just takes a little thought. And I don't know about you, but we've talked a lot about being busy and giving ourselves. Oftentimes we eat mindlessly. And so just stop and think, what am I eating? What am I putting in my mouth? Am I really actually hungry? It's just not a thing that we fortunately experience much anymore. Some of you have already gotten 2 or 3 minutes of exercise today. That's right.
Could you say the name of that book again?
Food Rules. Michael Pollan with an A. Yeah. I don't know him. I don't get any royalties from his book, but it was just easy to read. I think it's $6 or $7 or maybe $10 on Amazon. Moving more. 150 minutes a week. I'm sure you've all heard 30 minutes 5 times, 5 days a week. That's good. That's fine if you want to do that. Split it up however you want to. And try to work movement into whatever you're doing. Park a little further away. Heaven forbid, take the stairs. And the elevator, now that I work in Nashville, I have this tall building. And I know a bunch of those people work on the 2nd floor, but they'll line up at the elevator. So just work a little more movement into your day. Routine screenings, we'll talk about that in just a minute. And not using substances, especially tobacco. I know there's a lot in the news these days about vaping and all that kind of stuff. Regardless of how it gets into your body, there's nicotine in it. And nicotine is bad no matter what form you get into your body, because it really constricts the blood vessels and causes some of those diseases we were talking about. Okay, I guess we have to move on because I have like 30 more slides. Okay, myth number 2. These are some myths related to breast cancer. And for those of you in the back, I'll read them to you. There's only one kind of breast cancer. A lump is always bad. Most breast cancers are hereditary or genetic. Breast cancer always has clear symptoms. Young people don't really have to worry about that. The next slide will tell you that all of those things are false. There's a lot of words up there, but there are lots of different kinds of breast cancer. And depending on what kind it is, the presentation of that or how you first notice that might be different. There are a lot of reasons that our breasts have lumps in them, and they're not all bad. In fact, sometimes some things that you would read would say 8 out of 10 are benign, so it's normal. But what you need to know is what your own breasts feel like and how it changes through the month and through the hormonal cycle. And if you're past the hormonal cycles, getting to know where the normal lumps and bumps are. Excuse me, people are weird, they're lumpy, they're bumpy, they're lopsided. If you're perfectly symmetric, come talk to me afterwards, because you're not. God didn't make you that way. But you have to get to know your own body. And caffeine intake can change the way we call it fibrocystic changes in the breast. And so those are the kind of things that you need to understand. This is normal for me, or this is not normal for me. As far as family history goes, a lot of people that have breast cancer do have a family history. There's a fair number of people who do not. So if you do not have a family history of breast cancer, you are not immune. Only about between 5 and 10% of people have the gene for breast cancer. That doesn't mean only 5 to 10% get it. It's not up here because I wanted to test you. Fill in the blank. 1 in blank women will have breast cancer diagnosis in their life. I've heard 3, I've heard 5, 10, 20, 1 in 8. I don't want to get step on your toes too much, but most of these tables have 8 people at them. Okay? So it can happen. Breast cancer always has clear skin. Thank you. Can you do something about the pollen outside too? I'd like to blame it on something else, but I can't. Thank you. The first symptom of breast cancer is usually an abnormal mammogram. So I don't think I have to say, get your mammogram. If you're waiting, I don't feel anything, there aren't any lumps or bumps, I don't really need a mammogram, you're wrong about that. So get your mammogram and do your monthly self-exam. And then the final myth is that young people don't have to worry about it. Now granted, the median age for breast cancer is 62, but a full 10% of people with breast cancer are under age 45. And I think 2 or 3% are under age 35. And so just because you think you're too young for that, you're not wrong. All right, now, let's see. I know we've got, before you go to the next slide, I know we have 2 men right here. They're about to get really uncomfortable. Sorry, guys. Next slide. Leaking urine and painful intercourse are just normal parts of aging and have to be tolerated. Don't take a picture of that. You may not put that in the newspaper. When I was dancing and you got that camera, I'm like, my press secretary would be so mad at me right now. Like, I have to stop dancing because I'm going to be in the paper. We're laughing. We're kind of joking about this, but I'm not going to ask you to nod your head or raise your hand because I know the statistics. This happens, right? And this starts happening in your 30s and gets a little worse in your 40s and pretty common by 50s. And some of you know, it's like, leaking a little bit when you sneeze or cough or laugh or when you lift something. And it's not just urine, sometimes it's the other too. And there is, you're laughing, I'm saying, it's for real. Okay, so I said this was a myth. Part of this is sort of true. Some of it does come with aging, and we'll talk about that in just a second. The full myth part of this is that you just have to tolerate and there's nothing you can do. So let me explain to you, try to explain to you the anatomy of how that happens. So there is the muscles, and you might not even know that you have muscles down there. Okay, I'm not going to point because I'm afraid he's going to take a picture. And so there is, I'll just do like this. There is a sling. There is a sling of muscles down there that hold everything in. And just like all of our muscles, as we age, they get a little looser and a little floppier, and that's just the normal part of aging. It can actually be accelerated if you've been pregnant more than one, or even once, or more than once certainly, if you've had vaginal childbirth, if you've had any kind of pelvic surgery or intervention, if you're overweight, and it gets more as the age goes up, and certainly if you have a family history of that. Many of us in the room have a lot of those risk factors, and so if it hadn't happened already, I hate to tell you, it may be coming. And so not only can those weak muscles happen, the muscles get weak, they can also spasm and like just kind of get, well, my grandmother calls it bound up, just all get bound up. And so when that happens, the most common symptom, and the one we were sort of laughing about, is leaking a little bit, but that can also result in something called prolapse. And that's a fancy medical word for things start bulging and coming out where they shouldn't. They need to be in and they're coming out. And sometimes people think that's a mass, or sometimes people have trouble urinating or having a bowel movement because one or the other is coming out and dropping. Some people call that a dropped bladder or a dropped uterus. Those things happen because those muscles that are supposed to hold things in have kind of loosened up. That can also, with the muscle spasm, can create pelvic pressure, sort of making you feel like you always have to go to the bathroom, and can also tense up and spasm during or after intercourse, which makes it very painful. The good news, and this is the myth we were talking about, is that doesn't have to just be tolerated and lived with. There are a lot of things you can do. One thing's very simple. Dietary changes, changing your lifestyle, getting off a little bit of extra weight. And I'm telling you, I know people think it's a bunch of crock, but just a 10% weight loss is so life-altering, not only for things like this, but things like diabetes and your blood pressure. 10%, so if you're 180 pounds, that's 18 pounds. Does that get you to a normal weight? No, but does that get health benefits? Absolutely. So don't be discouraged if you think, oh, I've got so much to go, even just a little bit will help. That's one thing that you can do. Another thing is just avoiding the lifting and straining. Now this next one's going to make the men real uncomfortable. Everybody know what a Kegel exercise is? I'm not going to make you dance, but we're about to do one, okay? I can't tell if you're doing one or not. I don't want to know. But if you don't know, a Kegel exercise is, his head is getting red, like a whole. Thank you for being a good sport. If you don't know what a Kegel exercise is, those are the muscles that you use when you're relieving yourself on the toilet and the doorbell rings, like okay? So the muscles that you use to stop the flow of urine very suddenly, you can kind of contract them right where you are in your seat, okay? And if that is actually a muscle that you can work, and I don't mean to be crass, but we're just telling it like it is. That is a muscle that you can actually strengthen, and it will help with some of these symptoms. Is it going to cure it all? No. But will it help? Absolutely. And if you're not having these problems or not having them badly right now, you can fend it off by strengthening this muscle. Now, this next thing, I'm sure you're like, oh, I'm not going to physical therapy for that. But there is physical therapy for that. Sometimes you'll see that called women's health or pelvic floor physical therapy. And more physical therapy clinics I'm not sure about in the Henry County area, but I would be willing to bet that they do. Yes, ma'am, they do it. And so if you don't want to go in to your doctor or the physical therapist and be like, hey, I need that therapy for people who leak, you can say things like, do you have a women's health therapist? Or do you have a pelvic floor therapist? And they teach you exercises and sometimes do a technique called biofeedback, which is a little bit of measuring of the muscles and the muscle strength that can help you do that. And then there are medications and there are devices and there is surgery. But I wanted to make sure you knew that there are a lot of other options than just living with it or having to go full-blown surgery. Okay, everything else is very benign, okay? I mean, we're going to talk about like colonoscopies, that's benign. Okay, next slide. True story, when I was finishing up these slides over the weekend, I realized, oh, I am late on my annual checkup. My birthday's in August, and I usually have that's just easy for me to remember. I have my checkup every year in August, and here it is, middle of September, and I haven't had mine yet. So I did call, and I'm scheduled for October 4th. And I hope you know when your next checkup is, if you haven't had one recently. And so the importance of annual exams and these routine screenings that we'll go through pretty quickly. You can go to the next one. This is what you should be checked for every time you go in, or at least every year when you go in. Your blood pressure, your cholesterol, your glucose, which some people call sugar, and your height and weight, which is used to calculate your BMI. These are the cancer screenings, and some of these may be different than what you remember or have heard. I love her, and I know some of you in the audience love her. I have a 91-year-old grandmother. She's still trying to get pap smears. And grandmother, we don't do that anymore, okay? I'm glad you are trying to be on top of your health. We don't have to do pap smear at 91. But breast screening, mammograms usually start at age 40, depending on your situation every year or two. Maybe sooner, maybe more often if you have a family history, but these are just all general rules of thumb. I would lose my doctor card if I didn't tell you, talk to your doctor about what's right for you. It sounds like a commercial, right? Cervical screening, that is what you get in a pap smear. So that is what they're testing for, is looking at those cells on the cervix. For those, I don't want to insult your intelligence, but if you're not sure what a cervix is, that's like the, I was about to say a real crass spout. Of the uterus, it's the portion where it all comes together. That is the actual, when you talk about being dilated to have a baby, that's what the cervix is. That's what's dilated in there. So that is the outlet of the uterus. And the cells in that most often can become cancerous when they're infected by a virus. And that virus is called HPV. We'll talk about that in just a second, don't forget that. Every 5 years with HPV testing after age 30, unless your risk factors are different. Colonoscopy is everybody's favorite. Now there's some less invasive things that you can do, but generally speaking, you should start having your colonoscopies at age 50. And if you have a personal history of polyps or problems or a family history, maybe should be sooner or more often. Skin exams, don't forget your skin, particularly those of you who like to go to the lake and hang out by the water and in the sun. Make sure that not only you're checking yourself, but there are a lot of parts on your body that you can't see. Things like your back, things like your scalp. Don't forget those parts, bottoms of your feet. Just be sure that you're getting a good once-over on a regular basis. And then lung cancer screening, particularly at age 55 and up, if you've ever had a history of smoking. Some of you have already gone through this, osteoporosis screening. That's the brittle bones that you get as we age. That starts at age 65. And then if you've gone through menopause, most people have gone through menopause before age 65, but once you go through menopause, that's when you need to start thinking about those bone screenings, bone density screenings that your doctor or provider can set up for you. This is something that you may not have thought about, being tested for HIV or hepatitis C, particularly those in kind of the baby boomer and maybe a little bit before the baby boomer era. It was very rampant in the United States, still is, but this is the time period where people got infected and really didn't know about it. And they might not have any outward symptoms of the disease or may have liver issues and don't know why. And so if you haven't been screened at least once in your life for HIV and hepatitis C, particularly if you're having a lifestyle that is a little bit riskier, that's certainly something you need to think about doing. Also, other sexually transmitted infections like gonorrhea, chlamydia, syphilis, and hepatitis B. And then don't forget we need to take care of our emotional and mental well-being. Depression is the most common thing, particularly amongst those who care for others. We give so much of ourselves to other people that we oftentimes neglect ourselves. Depression is one of the leading causes of addiction and ultimately suicide. So don't forget what we call those psychosocial screenings, particularly even those that you care for if somebody might be being mistreated or abused. Okay, who wants shots? You know, I'm a pediatrician, I love shots. Public health, we love shots. Shout out to the Henry County Health Department. If you need shots, they're right over here handing out lungs. If you need lungs, they have those. They're very, they're not getting shots tonight, so please go visit their table. You know what time it is, it's almost flu shot season, and I'm starting to see some signs around town that people have got their flu vaccine in, and so be looking for that. It's about that time. At our house, we always just kind of remember October 1st. But it's not too early to get one now, so go ahead and get that. If you haven't had a tetanus shot in the last 10 years, you need one of those. And Tdap is a tetanus shot with the P on it is pertussis. You probably know that more commonly as whooping cough. It's back. It's back, and particularly if you've got little rugrats in your house, little grandbabies, or you're around a lot of kids, you need to make sure that you're protected from pertussis or whooping cough. Shingles vaccine, there's a new one. Even if you had the old one, you got to get the new one. And then same thing with pneumonia vaccine. It's really important, and it's one of those things that you don't have to do very often, but it really makes a big impact.